We'll be discussing about Sjogren syndrome today. Okay, Sjogren syndrome is basically an autoimmune exocrinopathy. Autoimmune. Okay, it means antibodies are produced against body's own cells. Okay, and exocrinopathy, it involves the exocrine glands, specifically salivary glands and lacrimal glands. We'll be discussing about in this detail now.
Sjogren syndrome is an autoimmune chronic inflammatory condition involving the salivary glands and the lacrimal glands. These two are the exocrine glands. Due to the involvement of salivary gland, there is xerostomia or dryness of mouth, and due to the involvement of the lacrimal glands, there is xerophthalmia or dryness of eyes. The term sicca means dry. Okay? These two together, keratoconjunctivitis sicca and xerostomia together is called as sicca syndrome or sicca complex. There are two types mainly. The first one is primary. There is only sicca syndrome and it is not associated with any autoimmune disorder. Secondary, it is associated with an autoimmune disorder, most commonly rheumatoid arthritis, systemic lupus erythematosus and scleroderma. Now coming to etiology, the exact cause is unknown. Basically, it's an autoimmune disorder where antibodies are produced against body's own cells. Genetic and environmental factors play an important role. With respect to genetics, the affected individuals will have a family history of person affected with Sjogren or any other autoimmune disease. This is basically due to the histocompatibility antigen, which is HLA antigen. HLA-DR3 and D8 are seen with increased frequency in primary Sjogren, whereas HLA-DR52 is associated with both primary and secondary. Coming to the environmental factors, certain viruses such as Epstein-Barr virus, human T-cell lymphocytic virus, cytomegalovirus and hepatitis C virus are thought to be associated with the disease. It is more common in middle-aged females due to the hypofunction of the salivary glands. There is xerostomia, and due to xerostomia, the mucosa, the oral mucosa may be painful, erythematous with burning sensation. The saliva is thick, ropey and frothy due to decreased salivary secretion. There is cervical caries and the tongue may show atrophy of the papilla and it may be erythematous with deep fissuring. Angular cheilitis and secondary candidal infection may be noticed. And with respect to salivary glands, due to the hypofunction, there may be diffuse bilateral enlargement of the glands. The ocular symptoms, patient may feel as if there is sand inside the eye, so they may have a scratchy feeling, which may end up in keratitis and conjunctivitis. Okay? The exocrine glands in skin, nose, larynx, pharynx, the tracheobronchial tree and the vagina may also be involved. So the secretions there will also be decreased. And common systemic symptoms like lymphadenopathy, fatigue can also be associated with Sjogren syndrome. In xylography, a contrast medium is injected into the ductal system and radiographs are taken for further assessment. Okay, these contrast agents may get collected into the glandular tissue and these collections are referred to as stylet stain. Okay. Punctate if it is going to be less than 1 mm and globular, the collections of the contrast medium are between 1 to 2 mm and cavitary if these contrast mediums are more than 2 mm in diameter. So, the appearance of these contrast medium in the intraglandular structures may take a branchless fruit-laden appearance or a cherry blossom appearance or a snowstorm appearance. In scintigraphy, the uptake is also decreased and the emptying is also delayed. In this picture, you can see the uptake is good in thyroid. Comparatively, it is less in the salivary gland. In shimmer test, the amount of secretion produced by the lacrimal gland is tested with the help of a sterile filter paper. The filter paper is inserted into the margin of the lower eyelid of an unanesthetized eye and it is checked for wetness. The wetness is less than 5 mm after 5 minutes, then it is diagnostic of keratoconjunctivitis. Next is rose bengal test, where the ocular surface is stained with rose bengal or lissamine green, and through a slit lamp examination, the corneal and conjunctival surfaces are checked for destruction.
The dysfunction of your salivary glands can be assessed by measuring your salivary flow rate. Okay, this is termed as cyalometry. So, in cyalometry, obviously, due to the involvement of salivary glands, the salivary flow rate will be decreased. Almost 83% of the patients with Sjogren syndrome, mostly primary Sjogren syndrome, are positive for these anti-nuclear antibodies. Okay, it includes anti-SSK and anti-SSB antibodies. Okay.
Biopsy of the minor salivary glands of the lower lip taken to examine histopathologically for diagnosis of Sjogren's. Microscopically, there will be focal lymphocytic infiltrate causing destruction of the acinar unit. Okay? The persisting ductal epithelial cells and the myoepithelial cells may undergo hyperplasia, resulting in the formation of myoepithelial islands. Okay? Score called focus score is given, the diagnosis of Sjogren syndrome, which means 50 or more lymphocytes and 4 millimeter square. Please note the criteria 1, 2, 3, 4, 5, 6. 1 and 2 are subjective criteria. 3, 4, 5, 6 are objective criteria. Okay. For a primary Sjogren to be positive, okay, any of the 4 out of 6 should be present. And 3 out of 4 objective criteria must be present. Okay. For a secondary Sjogren syndrome, okay, 1 or 2 plus any 2 from 3, 4 and 5 should be there.
Treatment for Sjogren is mostly supportive kind of management, where the artificial tears or artificial saliva can be used to increase your salivary and lacrimal secretions. Okay. And also xylogogues such as pilocarpine can be prescribed to the patient. And to reduce the caries resulting from decreased salivary secretion, fluoride application can be given to those patients. Okay, so basically it is a supportive kind of management.